Doctors of Reddit. How often do you see patients after they have tried to self-medicate? What's the worst mistake you've seen? Story 1. Heard the story but didn't see the patient. A woman in her 60s presented to the ER with episodes of passing out during. She underwent a full workup cardiac, neurological when she was admitted, and no cause was found, so she was discharged. She returned again with the same complaint a few days later, and divulged that this had actually happened during both times. Upon further questioning, it turns out that her husband had been using topical nitroglycerin paste on his penis for erectile dysfunction. When they had, the medicine was absorbed into her bloodstream, causing her blood pressure to drop precipitously. Her husband was advised to discontinue this practice. TLDR. Stick to Viagra. Story 2. Physician here. The one that stands out from among the rest of the field. Life-threatening problems with OTC acetaminophen, ibuprofen, naproxen, happened all the day long happened many years ago while I was a medical student. I was serving my rural medicine rotation at a primary care practice in the sticks. A man came in for an urgent appointment for a rash. I went to see him first to get working on the history. In the exam room, I met a very nice young fit man sitting bolt upright on the exam table looking very uncomfortable. During the history, it was revealed that he was a telephone line repairman and was working in late summer out on the telephone lines around the county, climbing them to reach the wires. He had been exposed to poison ivy this way over both arms and much of his torso, which had happened before. However, this time the rash was worsening with time. I asked him to remove his dark-colored shirt, and after he did, I almost fainted. He had open wounds all over his arms and chest. All of the blisters from the poison ivy had unroofed, and the tissue underneath was destroyed. Everything was bright red, bleeding, and weeping. It looked intensely painful. I'm having a hard time describing it. It was the worst skin findings I'd ever seen. I thought for sure this was Stevens-Johnson syndrome, or 10, so I started asking about medication use. He told me he takes no medications at home, but that his grandmother gave him a gallon of solution to put on the rash, which he had been using regularly since the poison ivy began. He didn't know what was in it. We called Grandma. What was in it? Was bleach. He got to go for a fun trip to the burn center. Poor guy. TLDR. Man treated really bad poison ivy with bleach. Lots of skin was lost. Story 3. Lady in her mid-60s comes in with a terrible burn on her hairline and scalp. I ask what happened, and she said she was coloring her hair with the leftover dye from a month or so ago. Needless to say, she had a third-degree chemical burn all over her scalp. Okay, that's problem 1. We ask her if she has any allergies because we want to give prophylactic antibiotics. She says no. We ask about her daily meds. She rattles off a bunch including 1,000 millimeters of amoxicillin augmentin. We ask how long she's been taking the augmentin. She replies 2 years. Every day, for 2 years, she's been taking massive doses of antibiotics. Her reasoning? To keep myself from getting sick. We went hunting for side effects. Found oral and vaginal thrush, massive yeast infection in her colon, malnutrition, stomach ulcers, and multiple open sores on her feet and knees. Plus, she got a super infection on the burn site a few days later. No fun. TLDR, don't take antibiotics if you don't need them. Seriously. Story 4. Nurse here. At a get-together with friends where the wine drinking got out of hand, I had a friend burn himself on the oven while making pizza, then try to cauterize that wound with his lighter. Story 5. ER doctor. First one that comes to mind, although probably not the worst, was a woman who came in with worsening back pain. She had fallen the previous day and filled a gallon-sized bag with ice and placed it on her back. She fell asleep with it on her back, and a few hours later she noticed that her back hurt even worse. So she took another bag of ice and put it on, and once again fell asleep. When I examined her, she had 2 large areas of burns with blisters on her upper back, each about 6 inches in diameter. When I took a picture and showed it to her, no, I will not post the picture. Her eyes welled up with tears. She couldn't believe that ice had given her a second-degree burn. Lesson: 15 to 20 minutes at a time every 2 to 3 hours maximum for heat or ice packs. TLDR. Patient left ice on her back too long, got a nasty burn. Story 6. Pharmacist here. Patient came in and wanted to self-medicate his cat's pink eye. He wanted to know what the vet would prescribe and if it was available somehow over the counter. After a long and trying discussion, he is insistent on putting generic Neosporin in his cat's eye. I repeatedly instructed him that it wasn't safe due to sterility reasons and that it could harm the cat, worsen the cat's condition, or cause some other problem for the animal. His reply to me: well, I'll try it in my own eye first and see. And just like that, as mysteriously as he arrived, he was gone. Story 7. Only semi-related, but the gym teacher at my junior high had a student who broke his arm during class, and the teacher's response was to insist that it was only a sprain, and that the student should do jumping jacks to help it feel better. His classmates had to call him an ambulance. Story 8. I once had a type 1 diabetic come into emerge vomiting nonstop. I asked him if he had anything unusual the night before, and the patient denied it. On history, there was nothing else I could find that would explain the non-stop vomiting. I went back and asked the patient again to tell me exactly what he had the night before, and he looked at me and said, "Well, do you think the liver cleansing tea my naturopath gave me could have anything to do with this?" Naturopathic teas often contain hepatotoxic compounds, so this patient was trying to cleanse his liver when in fact he was doing himself more damage, because he was a type 1 diabetic, and vomiting nonstop. He went into DKA, potentially life-threatening complication of type 1 diabetes, and had to be admitted to hospital. TLDR, if naturopathic medicine actually worked, it would be called evidence-based medicine. Story 9. As a veterinarian, the holy trifecta are giving aspirin to cats, giving ibuprofen to dogs, giving estrogen to dogs, usually done by MDs or nurses. All three of these run a good chance of killing the animal. Edit. As per some comments, giving acetaminophen paracetamol to cats should also be added as a very bad idea. Story 10. Asked my optometrist about his most messed up stories. He said he had an elderly fellow, believed in a literal interpretation of the Bible. Apparently somewhere in there it recommends liver juice to treat eye infections. So when the old guy's eyes got infected, he bought chicken livers at the grocery store, held them above his eyes, squeezed them, and let the liquid run into his open eyes. My optometrist said when the guy came in, his eye infections were so bad that pus was streaming down his face out of his eyes. And the best part was, my optometrist cried from laughing while telling me the story. Story 11. We got given a case in a lecture of a man who had a rash on his foot, Googled it, and decided it was eczema or some similar inflammatory disease, so ordered and applied a steroid cream. For those who don't know, these kind of steroids act by dampening the immune system, the overactivity of which is the cause of diseases like eczema and psoriasis. However, he in fact had a fungal infection and was just reducing his body's ability to fight it off, if I remember correctly. By the time he got to the doctors, he needed it amputated. TLDR go to the doctor. Story 12. Heard about a 911 call that went something like this. Operator 911. What's your emergency? Caller, my 4-year-old daughter ate some ants. Operator. Oh, ants around here aren't toxic. She'll be okay. Caller. Oh, that's good. I fed her some ant poison just to be sure. Operator. You better bring her in. Story 13. People with tooth pains trying some miracle remedy, and when the pain stops, they think they're healed. What they don't know is that it means their nerves have been infected. In fact, so serious that the nerves died and rotting below the gums. Only until the pain starts again and their so-called remedy doesn't work do they go to the dentist. By then, there is no choice but to remove the teeth and probably some additional surgery too. BTW dentists poke sharp objects at your gums for a reason. It's to check for periodontal disease. Edit grammar. Story 14. Pathologist. I've seen a few cases of patients who basically wrecked their livers through use of some sort of herbal remedy, like for weight loss or something similar. Be careful with unregulated dietary supplements is what I'm saying. Story 15. I'm not a doctor, but I work at a pre-post-surgical eye clinic. The worst I think I've ever seen was someone wore their contacts for 3 months straight. It was gross. Remember guys, take out your contacts at night and wash them like you were told to do. Story 16. I was working in a clinic when a man came in with his blind wife. She is diabetic, and during my questioning I found out she had had a few episodes of low blood sugar in the past few months. And I mean low, as in unable to ingest food to raise her blood sugar. The husband told me he had to inject his wife to bring her around. Usually in these cases you would inject glucagon, which is basically the opposite of insulin. It raises blood sugar. He proceeds to tell me that the glucagon is too expensive, so he has been dissolving sugar in water, drawing it up, and injecting it into her thigh. I tried to hide my shock, but it must have been obvious. He just looked at me and said, "Well, it worked, didn't it?" I tried telling him all of the reasons he should use glucagon and not sugar water, but he wouldn't have it. I even told him that the pain of the injection is probably what woke his wife up, not any increase in blood sugar. He said the glucagon was too expensive. I called around to a bunch of pharmacies and found it for $20 for 2 injections, but he still refused to buy it. We ended up calling Adult Protective Services. TLDR husband injected his blind diabetic wife with sugar water to revive her from low blood sugar episodes. Story 17. I am a neurologist. One of the worst I saw was during my internship, an older fellow who had become short of breath. He had asthma, so he medicated himself for his asthma attack with albuterol. He did not have a handheld inhaler. He had a special machine like they use in the hospitals where he could buy albuterol in bulk and take a 10-minute nebulized treatment. It's cheaper. Patients with bad asthma used to get these a lot. Less so these days. He briefly felt better, but then felt worse and took another treatment. This went on for a few days and he decided that he must be having a really bad asthma attack. So he strapped the nebulizer mask on and gave himself a 9-day continuous treatment. Finally, he couldn't breathe with the mask on and came to the ER. Although this fellow had regular old pulmonary allergic asthma, with all these drugs he had given himself cardiac asthma, all that albuterol had triggered serious abnormalities of heart rhythm, and he had gone into congestive heart failure. Investigation revealed multiple stenoses of coronary arteries. He received the usual stents and went out of the hospital healthier, happier, and a little wiser. I see an unbearable number of older patients who have medicated themselves into delirium with diphenhydramine. People say, oh, that's Benadryl, which is true, but it's also Zizquil, Dimetapp, generic sleep aid, generic allergy aid, generic sinus remedy, and probably also sold under 24 other names, occupying dozens of square feet in your local pharmacy's OTC shelves. Because it impairs memory, it's not unusual for me to see a patient who pops one, forgets they did, then pops another, etc. By the time they get to me, their primary doc is convinced they have Alzheimer's disease. I had one patient who really couldn't get it. I would explain the above to her, and she would patiently explain back to me that no, this one was for sleep, and this one was for sinuses, and this one was for seasonal allergies. She explained this like I was a somewhat dull child. Her husband, who took good care of her, recently passed her children immediately placed her in a locked ward where nurses supervise what medication she receives. Sad story, and really probably has something to do with mild mental retardation in addition to medication misuse. Story 18. I heard this story, but it's the flip side of this story. I only caught wind of this because I volunteered at my local animal shelter. A guy had come into the animal shelter and wanted to check out one of the pit bulls that was just a really big sweetheart, named Mo. Mo had practically been raised there since he was a puppy, and was a great companion around other dogs, incredibly passive and kind of stupid sweet. He had been adopted and returned before, but not because of any typical pit bull behavior, such as aggression. It was only his appearance that set people off, which is why we were excited that a guy was interested. This dude was a doctor and already owned a golden retriever Labradorone of the generic family dogs. He was interested in introducing the dogs to see how they would get along. For some reason, a volunteer let him check out Mo for a walk around the area, instead of letting the doctor bring his dog into our caged dog run, the area where dogs go to get some playtime and meet potential owners. So he took Mo out on a walk in the area around the shelter with his dog. Apparently what happened was that on the walk, the doctor's dog freaked out and got really aggressive, so it bit Mo through the ear. Almost clean off, as in it must have been really severed based off of later evidence. Being the passive honey that he was, Mo didn't retaliate. You know how he found out? The doctor thought that he could fix it by stitching the ear back on and returning the dog without mentioning his own dog's aggression. When the shelter checked him out, he was in pain and his ear was seriously up. You bet that doctor got an earful. He should have lost his license for attempting to practice on an animal in secret and botching the job because our veterinarian had to fix it. In the end, the ear was fixed and Mo has found a permanent home. I guess it just goes to show that just because you are a doctor, it doesn't mean you're not stupid enough to try to perform on an animal instead of a human. Story 19. Med student here. Literally all the time. I've seen super overdosing OTC meds. Guy with stool and abdominal pain who we found out used 4 goody powder packets a day for over 5 years. Patient who had someone try to nail file his hemorrhoids. Not sure how he thought that would help. Massive infections from people literally stapling a wound shut with an office stapler. Story 20. I'm a pediatric nurse. Parents brought their child in with weakness. Through the general admission questions, we discovered that they were into natural treatments. When their infant child developed tummy problems, they decided to give her a bottle of honey water to help with that. The baby was diagnosed with botulism. Edit: I have nothing against natural remedies. I only put that part in because it helped lead us to the diagnosis. Honey naturally carries the botulism toxin, but children under 1 year old don't have the immunity to fight it off. Story 21. Gynecologist friend in Lebanon told me about women trying to abort by themselves due to abortions being illegal. So you have the patients coming into ER with hemorrhages due to knitting needle insertion. And that is a classic but a very frequent case is massive septicemia due to the insertion of a raw piece of meat, or sometimes a dead. The crazy part is that those cases happen quite frequently. Edit: not kidding. Knitting. Story 22. Not a doctor, but I was observing in the ER for this. During my senior year in high school, I did a program called New Visions that allowed seniors to skip half their day at school and instead spent it job shadowing doctors, surgeons, nurses, physical therapists, etc. I scrubbed in surgery, saw a bunch of births, vaginal and C-section, assisted during codes, and was eventually certified as an EMTB through the same program. It was awesome. Man comes into the ER after trimming trees on his farm and a very large branch had landed on his head. He had split his skull, and instead of going to the ER, he had his wife clean his scalp with vodka and staple his scalp shut with a staple gun and thick sewing thread that they used on horses. According to him anyways. It was severely infected and nearly gangrenous. Several of the staples had created microfractures on the skull too, apparently. The ER doc's face when the man nonchalantly described how he just got drunk and had his wife use the staple gun on his skull was hilarious. Guy had to go into surgery, and it took about 6 hours and several skin grafts to repair the damage. Story 23. I work in a dental office. Most common thing we see is people placing an aspirin on their gums next to an aching tooth. All that does is severely burn the gums and makes the pain worse. I've also met a few people over the years who have taken their own teeth out with a pair of pliers. One guy we saw had a problem tooth, went to pull it out, pulled the wrong one, then tried again and pulled the problem one. He shattered the alveolar bone in that area and had to be sent to an oral surgeon immediately. Story 24. Resident physician here. I've had numerous patients who've rejected medical treatment for a small, localized, and easily treatable cancer in favor of naturopathic homeopathic remedies. Inevitably, they represent years later with diffusely metastatic cancer in their brains, liver, bones. It's everywhere. By that point, the conversation shifts from how I can cure them to how I can make them comfortable before they die. Story 25. Internal medicine NSAIDs leading to ulcers or kidney disease, especially the doses that goodies or BC powder provide. It's over the counter, so it must be safe. It's too common. Story 26. At the Poison Center, we have gotten an increasing number of calls from people who have overdosed on niacin vitamin B3. Apparently, Dr. Google tells them that it can mask a drug screen. This one sad 18-year-old was hospitalized for 2 days for niacin overdose once. He had to cancel his interview and he still tested positive for THC. I will never understand why people can't just abstain if they have a scheduled drug screen. Story 27. Medical student here. Depressed people drinking because it makes them feel better in the short term. Unfortunately, it worsens overall depression and can give you liver disease, thiamine deficiency, social problems, etc. Story 28. Alcohol as self-medication for depression, anxiety, whatever is the worst thing we see. Not necessarily because it's the most entertaining or the most fascinating medical issue, but because it's absolutely rampant throughout the nation world. I sometimes wonder if non-ER staff have any idea how bad it is. Story 29. I'm a medical student. I have two that stand out. First, we had a guy come into the free clinic complaining of knee pain. He is a larger guy, an ex-football player who developed a bit of a gut after he stopped playing. He said that he has some old injuries, torn meniscus, chronic arthritis, etc. He used to go to his doctor in another state, who would drain the knee and give him a steroid injection every so often. When he lost his job, he lost his insurance too, hence being seen at the free clinic. Before he decided to come to us, though, he decided it was a good idea to take a needle and try to drain his knee himself, 4 times. On physical exam, the knee is massively swollen, tender, bright red. Classic signs of a septic joint. We weren't equipped to treat it in the free clinic, so we strongly encouraged him to go to the ER. He didn't want to go because of his insurance situation. We tried to explain the gravity of the situation to him, but he refused to listen. Without prompt treatment, he could end up losing his leg. We offered to call him an ambulance to take him to the ER, but he refused and left the clinic. Never did find out what happened to him. Second, this one I heard secondhand from a classmate. We had a firefighter come in with some burns on his leg. I believe they were incurred from a drunken cooking accident rather than any on-the-job heroics, but I could be mistaken. Anyway, the burns were serious, but he was expected to make a full recovery quickly enough. He was discharged and instructed to eat a lot of protein to help him recover. He interpreted this as get as much protein into your body as possible, by any means necessary. He goes home, takes some protein powder, and mixes it up with water, and sets it up in an IV. Needless to say, he developed a pretty serious bloodstream infection. It prevented his burn from healing correctly, and he ended up needing a partial amputation of his foot. He eventually recovered, but it took way longer, and there were so many unnecessary complications. Story 30. Had a friend who was an ER trauma nurse before he went nutty. He told me about the selfie change guy. He got one ball severed but couldn't tie off the bleeding. So they're sewing him up and he asked, can you take off the other one? Story 31. M and EMT. One of my first calls was an 80-year-old man living in an assisted living facility. He had bought at least 150 bottles of some naturally lose-weight quick pills that he saw late night on TV. He had been taking an excess amount of them for at least a day straight. We got there, and his mental status was clearly altered. Didn't know where he was, etc. I wish I still had the picture of the stacks of cartons he had in his small room. I still wonder how he got them inside of the facility. Story 32. Guy came in with a deep laceration to the leg. Genius decided he would superglue the wound shut. It became infected and then gangrene set in. He then waited until his leg was a greenish-black before coming in. He lost the leg. Story 33. I am not a doctor, but this is important. About 10 years ago, my now mother-in-law had what everyone thought was a severe panic attack or mild heart attack. They rushed her to the hospital and found out it was her gallbladder. She said it was nothing serious and didn't get it removed. About 3 years later, same thing happens. Possible heart attack, turns out it's her gallbladder. Her husband, my wife, and I were all there in her room when the doctor is recommending taking it out. She says no. The doctor then tells her no more spicy food, junk food, or fast food. After he leaves, she starts going off about how doctors just want to cut people open to make money. And I swear, she says, I just need lemon juice. That will fix it. Fast forward another 3 years later of not listening to a doctor and taking lemon juice. My wife gets a call around midnight from her dad, who is mumbling incoherently. After about 30 minutes, he explained to my wife that my mother-in-law had woke up screaming painfully and he had rushed her to the ER and was scared she was going to die. The hospital had told him that she was going into emergency surgery. About 4 hours later, we found out that they had removed her gallbladder and that it had actually ruptured. She is still alive and still tries to give my wife and I medical advice. Edit server to severe. Story 34. Not a doctor, but when I was about 16, I started having these little red irritated spots show up on my arm. My mom was immediately like, you have psoriasis is all, just go tanning. So I tanned for about a week, and they just got worse. Now I had them all over my body. I had spots on my eyelids even. So I go to the doctor finally. Turns out I had ringworm, and by tanning, I was basically rubbing them all over with the lotions and incubating while I tanned. Thanks, Mom. Story 35. My uncle is a doctor, and a few years ago, when I was trying to figure out if I wanted to go into medicine or not, he let me shadow him in his office for a day. Well, this one girl came in to see him. She was absolutely beautiful, mid-20s, perfect makeup, hair, everything. She was in to see my uncle because her toe was in unbearable pain and she could barely stand to walk anymore. Well, my uncle has her take her shoe off, and I almost threw up. He had to take a second and turn away to collect himself. Her toe was like 3 times its size, and the outside looked slimy and like the skin was about to drop off. After a few seconds of stunned silence, my uncle asked what happened to it. She said she was walking one day, and she cut her toe pretty bad on some glass while she was at her apartment. She called her grandmother and asked if there was anything she should do to stop the bleeding and heal the infection. She said her grandmother was a shaman, and apparently she went to her for all medical advice. Well, guess what the grandma told her to put on it? Mayonnaise. Yep. She didn't even clean it or anything, just plopped some mayonnaise right on it. We asked her how long she had been doing it for. 2 weeks. Constantly. The smell was absolutely terrible, and when my uncle even slightly poked it with something, she would almost scream in pain. He immediately told her to go to the hospital and told her that one of his buddies would be waiting there for her. So later that day, my uncle's friend calls back and said that they had to do surgery on her toe, and that there were 2 or 3 pieces of glass embedded deep in her toe. He said that when the surgeon made an incision, the toe basically exploded and pus went everywhere. They had to remove all the dead skin, and almost had to remove the toe because the infection was so bad. But apparently she made a really great recovery. So that's good. Me and my uncle will never forget that though. Story 36. There is a subsection of the transgender women community that self-medicates hormones. They order gray market hormones, which is technically illegal, and can and do get seized at customs sometimes, and actively encourage others to do the same. They believe that doctors are bad and don't know what they are doing in terms of trans people, which sometimes can be said about private endocrinologists. Frequently, there are posts on the community by self-medicators with basic questions that should be answered by doctors easily. Sometimes they will forego all blood tests because they don't have the money even though they cost $50 at an independent clinic. Also, there are clinics that give hormones on an informed consent basis in the US. There are many clinics spread throughout the country. Clinics are almost always on a sliding scale. The clinics prescribe and monitor all doing. People can also go the private route by getting approved by a therapist, appy, and an endo, sometimes quite expensive. Hormones from Walmart cost $35 3 months. Hormones from gray market cost 203 months. Story 37. I might have been one of those people myself. I have a condition for which I have to take a lot of medication, but I also have problems with short-term memory. One time I took all of my medication for the day, but after a couple of minutes I kind of forgot. So I took it again. Obviously my stomach started hurting after an hour, so I took a couple of my prescribed antacid. Got a really bad headache after that, so I decided it was a good idea to take a couple of ibuprofen. After a while I started feeling really strange, so I called my parents. I was so incoherent they called an ambulance. Had to get my stomach pumped. I always thought I was kind of a smart person, but I guess not. Story 38. Not quite a doctor, but a med student. There was the man who had a prolapsed disc in his back and, rather than go to a doctor, decided to hang himself backwards off a ladder for a few hours. He got lightheaded after a little while, fell off, and was lucky not to break his neck. Story 39. Not a doctor, but a close friend who worked in home health care in a very low-income area. He said he went into a home where the woman was complaining of pain in her stomach and her pubic region. He started questioning her. What kind of daily activity did she engage in? Was she sexually active? Did she use birth control? Etc. Come to find out that yes, this woman was sexually active. Her form of birth control? A potato carved in the shape of a diaphragm. Potato nice warm wet environment holy disaster Batman. He said there were tendrils, like an octopussy. Shudder a mother came to me with her kid who was really obese. I mean, I never saw anything like him before with very specific features. She originally came because he had sore throat, but after taking history from her, I found out that 6 months ago he had some severe allergy and a doctor prescribed steroids for him. Then, the mother thought that in order for him to not get that allergy again, she would keep giving him steroids. So he has been taking steroids for a straight 6 months, developed what is called Cushing syndrome, the high body weight and specific features, and to only think she came because of the sore throat. Not this. I was so pissed that day. Story 40. My great-aunt was a naturopathy fan. She had a small wound on her leg and insisted on treating it with mud from anthills. She developed gangrene and sepsis, refused to be hospitalized, and died. Story 41. I would say a lot of people try to self-medicate with painkillers that they either got while they were having an issue like back surgery problems or some dental work. They still have trouble and pain, but the doctor won't give them more because so many people abuse doctors for this reason. They end up going to their friend's street to get medication painkillers and become addicted. It happens frequently. Story 42. We see them all the time. The best part of it is that they usually don't include that part until the second visit. 45 minutes into the interview. I have just started telling everyone that our urine and blood samples combine to find everything you have taken in the last 6 months, so it would just be easier to tell me now. Edit yes. I know this is a lie, but the stupid people don't, and they are usually the ones I'm trying to help because they have already tried to help themselves. Story 43 opposite. I was working on a project at school and eventually had an allergic reaction to a substance. My arms were swollen and completely covered with rash. I eventually went to the doctor and they gave me prednisone, which cleared it up wonderfully. From then on, I used gloves when working on the project. However, near Christmas time, at the end of the semester, I developed a cold and had a runny nose. So I would rub my nose while working on the project. Went home for Christmas, and the rash started developing on my face. It was on my nose and ears mostly, and it was miserable, swollen, and itchy face. I couldn't immediately get a prescription, but the family dog was on doggy prednisone. I took doggy prednisone and it worked awesomely. Story 44 pharmacy student here. I had an older woman usual patient stop by the pharmacy for a prescription of warfarin Coumadin, which is a blood thinner used often to prevent clots, primary and secondary prevention. With warfarin, you often have to play around with the doses a little bit before finding something stable for the patient. This is confirmed by drawing a little blood for INR testing measure of blood clotting, and this is usually done anywhere from every few weeks to every few months, depending on the patient and how stable their INR is. While the woman wasn't new to the medication, the prescription for her warfarin was a slightly increased dose from her previous fill of the prescription. Her previous prescription was warfarin, 5 mg once daily. Her new prescription was warfarin, 5 mg every other day. At the register when I was ringing her out for her prescription, I asked her if she had any questions about her prescription. Most of the time, people tell me they have no questions about their medications. However, she did tell me her clinic told her that her INR was a little low, hence the increased dose. A week or so later, I get a phone call from the local hospital's ER trying to get a medication list for her. When the nurse inquired about warfarin because the patient's daughter had mentioned it, I told the nurse 5 every other day. I was shocked when the nurse told me the patient was taking it every day because she was worried about her low INR. So she was self-medicating in an attempt to make it right and ease herself. The end result? Intracranial hemorrhage. Story 45. About once a month, you'll see a patient in my office who tried to drain their own abscesses or boils with sewing needles, only making it way worse. By the time I examine them, I usually have to send them to the hospital for IV antibiotics. But without fail, every patient will say, "But I dipped the needle in alcohol first so I wouldn't get infected." Basically, don't do surgery on yourself at home. I can't believe how often I have to tell people that. Story 46. A friend is an ER doctor in a hospital near a prison. One of the inmates apparently had an eye that was bothering him, so he took Jesus' advice literally and plucked it out with a spoon. Self-medication? Maybe not. So does self-surgery count? Story 47. I read a story of a guy showed up to the ER with a raging infection. He had slipped outside of his house and cut his leg open on a water tap a few days prior to him showing up to the hospital. Turns out, he had shoved a piece of raw steak in the wound and sewed it up himself, using thread. Story 48. I'm not really feeling this lithium working, so I'm gonna double my dose. After a few of those doses, lithium toxicity and kidney failure. Intern calls me on the weekend to tell me about my patient's admission. Biggest warning we give when prescribing lithium is to not take more than prescribed. Story 49. Not a doctor, and not my story, but the guy that my husband is currently sharing a hospital room with on the neurological observation unit is there because he was diagnosed with epilepsy. His doctor put him on medication to control it. After 3 months, he was still having seizures. Instead of going back to his doctor, he goes to Dr. Google. Dr. Google says that he is having breakthrough seizures due to his levels of the medication being too low. He was taking them as prescribed, had absolutely no reason to believe that this was the case, instead of the much more likely possibility that he just needed a different medication instead. Instead of returning to his doctor, he starts trying to raise the med levels when he feels the slightest bit like a seizure is coming on. So every time he got a tremor or a headache or just felt off, he would take a handful of his pills. Needless to say, this didn't stop the seizures, and he eventually overdosed himself. The last time, he passed out, hit his head, and now has epilepsy and head trauma. People are dumb. Story 50. I did an MRI on a patient who had treated her breast cancer with sodium bicarbonate. The patient presented to DEM with numbs hands and neck pain. The MRI showed extensive bony metastases and a pathological fracture of C2. Basically, the cancer had spread all through her body and had weakened her bones to the point that they were disintegrating, putting her at risk of damaging her spinal cord, or worse. It's more just sad that people want to believe that these simple remedies can treat complex issues as opposed to modern medicine.